Hey, David Zulak's our guest. We're glad to welcome him back inside Brandy's with TMC Therapeutic Massage Council, and we appreciate you taking some time with us today.
Well, thanks for inviting me.
I guess lots of research out there, and there's some new information coming out about what you do and how it kind of impacts the human being.
It's very exciting for our profession because it's hard to get for massage therapy as an organization to get a lot of money for research. So this actually happened in McMaster with Dr. Turnipolsky, who's a very well-known neurologist. He does muscular diseases. And it actually came about because he had an injury in his hamstrings in his leg from a skiing accident. And he wondered why massage took his pain away. Well, physio did this, but massage didn't take his pain away. So he does muscle biopsy. So he got some people together. He exercised until they were exhausted and in pain. And he would take a biopsy from each leg, before the exercise, after the exercise, and then one leg got massaged, and then he took another biopsy of both legs, and he found in the leg that received the massage that this leg was still sort of going through an inflammatory process because he always made them go farther than they should.
Right.
This one, the massage would drop that level of inflammation down. So it seems to have an anti-inflammatory response in muscles and nearby tissues. Plus, though, he also found that they're called mitochondria. They live in cells, and there are little generators of power, and they give the power for the cell. He found that also, in terms of recovery, those were getting turned on faster, and there was even a suggestion that they may actually be replicating, having more of them in a cell, so that the muscle would have more energy sources.
So this has to be more than a blood flow situation. I guess what you sound like you're talking about in some cases when you're doing that work with muscles is that you're increasing blood flow,
yes,
and that'll kind of speed up the healing process, but it sounds like there's more to it than even that.
Yes, I mean, we're talking, he was looking at what's happening inside the cell.
Right.
So myself, I've always explained massage in terms of blood flow in and out. I mean, if you can't get enough blood in, you're not getting nutrients, it's just not oxygen, it's also muscles are always breaking down. They're like houses. A cell is like a house. So you have garbage that goes out, things wear down, you got to fix them up, just normal wear and tear. So if you need repair, you've got to have good blood flow. It's got to get there. It's also got to get out, so you've got a good venous drainage. You can't have it pooling in the legs, right, and swelling. And the same with the lymphatics, the fluids that sort of take out other debris. So flow becomes very important. So this sort of shows that as we improve the flow, we may very well then be directly affecting, obviously, the health of the cell. And so that's just really, it's an obvious next step, but just looking a little deeper into it. And it's nice to have, hard scientific evidence for any profession to say, we can say we do lots of things, but, to have something to back it up is quite nice.
Well, it puts those two letters in, therapeutic massage, that's which right, we always refer to, because this is not a recreational, boy, I'm really stressed out and somebody's going to make me, feel better.
Right.
We're talking about, if I'm using the word, I guess, injury repair in a lot of cases. Right. How do I know, David? Yeah, I've gone through physio at different times. I've gone through acupuncture as part of physio, and I've gone through, what's the word I want to use? I've gone through where I got stretched out. I've gone through that. How do I know that massage is going to do more for me than other forms of repair or therapy?
Well, normally massage is a little bit more whole body thing. So if you have an injury, often you focus on that, you focus on the shoulder, you focus on the wrist. We would want to incorporate our work there with the whole body. And actually to affect blood flow correctly, to affect venous flow and nerve flow and everything, you actually have to address, in general, the whole thing and then work specifically for certain things. And also we look for postural or positioning things in the body. What could be affecting this here? Is my shoulder forward? Am I slowing my blood flow? Am I, maybe these muscles aren't in the right position and hence my shoulder is starting to wear on me. So
I guess you're talking about not only injury, but the effects of injury. Because
if I have compensation.
If I have a problem with the bottom part of my arm, maybe I'm overcompensating by using a shoulder.
That's right.
And I've hurt the shoulder. Right. This might heal, and now why have I got a problem in a different area?
And often what we see are, because people will go to, if it's a real bad trauma, of course, they're not coming to us with broken bones. So when they get to us, it's often they've had it for a while. And often they're coming in with, my shoulder's really sore, but it may have actually started in their neck or whatever. So we, where the pain presently is might be because of how they tried to, keep moving while
body
they were injured.
compensated.
And then the compensation can actually become more of a problem.
I'm guessing the average person is going to be surprised by who you get to deal with on a regular basis.
Yes.
So if we can get you sit there, we're going to talk about that when we return.
Okay.
David Zulak's with us, Therapeutic Massage Council. I'm guessing the average person would be really shocked to know who you deal with on a regular basis.
Yes, I mean, we might see athletes, and then there's, someone who does something manually and hurt themselves. But I would say the largest group that comes as a group is people who sit at computers all day long, who are stuck at a desk, or even those who stand in one place. It's actually, in a sense, what's common about them is they don't get to move, right? You're sitting at this desk, you're working on this computer, you got no reason to get up because you can file everything, you can copy everything, print from that spot. And it's actually the lack of movement in the muscle that gets you into trouble. Now, it does relate to what we were talking about in terms of inflammation and the research, in that when a muscle contracts, the blood slows in getting in. It sort of like cuts it off. But as it pushes the venous blood out, right? The used blood takes out that, pushes out the lymph, which is sort of extra fluid that has larger debris that can't go into a vein. And then when it relaxes, the blood comes back in. So we call it a muscle pump. And you can think of it as the respiration of the muscle, breathing of the muscle, right? How to get the oxygen in and the nutrients in and get the bad stuff out. So if you're just sitting there, though, and this is just zzz, right, and it's not really being used hard, and it's not ever really, because you're sitting there, you got to keep your head up, it's not really relaxing. The blood flow is not that great, and certainly getting the things that may be irritating to the muscle, as the chemicals break down and the garbage is thrown out by the cells, if they stick around too long, they'll break down into chemicals that will then cause inflammation. So
is it too simple to say that pain is the body's way of saying don't do that?
It is, and it's all pain really is chemical in that sense. The cells that are strained, injured, whatever is going wrong, when they set off their alarm, they start spitting out a whole series of chemicals, and they call it like a cascade. So then that makes this happen. So first it might cause pain, and then it says, no, I also need some fluid here, so you swell up, right? And it starts this whole process going. And often inflammation is actually, the body can be overreactive in the sense like it's always emergency, right? So what's happened? I don't know. Let's make everything tight. The muscles also will tighten up to splint the area, right, to hold you, to keep you from moving it. So hence pain does tell you don't move it. And all of that can get sort of stuck in a stage where you don't actually then get to healing. That inflammation has to start clearing out before the body will actually start the actual repair work.
We looked at the website a couple of minutes ago, TMC, where people can find out more. I'm getting the feeling that what you're doing now is a big part of what you do. It can't be somebody who walks in and says, hey, my leg hurts me, and you massage it away.
Right.
Maybe a matter of finding out, okay, so what do you do? Are you exercising?
Assessment
Are you sitting?
is, if you don't know what you're working on, you can't treat it very well. So if someone says, my shoulder hurts, and you don't try to figure out, well, what is it? Which muscles could be involved? Is it joint involvement, this or that? So you have to ask some questions. You do some orthopedic tests to see how things are functioning, some muscle tests. Once you know what's going on, then you have a better idea of what you can obviously do and how to approach it. And you have to know how acute it is or how long they've had it. So yeah, you have to get a lot of information from the client directly, say verbally, but also in a sense, we listen to the body. Right, we go in, and as we're working and palpating, we're seeing, is this tissue boggy? Hence, does it have some fluid, some swelling in it? Is it too tense? Do I feel hard fibers? And so you can create a picture in your head. And with that picture, then you decide, how can I proceed in this treatment and a few other treatments ahead to get them to a better state of health and give them the exercises and stretches that might help them along the way and help me along the way. So
well, I guess the one thing I want to know is that I've been involved, I'll give you an example, of chiropractic. Chiropractic seems to be kind of a lifelong sort of situation. Is therapeutic massage in the same area? Do I get to the point that if you assess what's going on, how maybe I caused the problem, you're able to repair it, and I go on my merry way, or is therapeutic massage something I'm going to need for the rest of my life?
Not need. You could use it as a, like once every 4 or 6 weeks or every couple of months as a way just to check in and see how things are going. But I tell my clients, personally, that if I'm doing my job right, yeah, in whatever set of, depending on what I'm treating, in this sort of set of treatments, I shouldn't have to see you anymore for that.
David,
I haven't done my job right.
We could do a whole show with this, so it means we're going to have to get you back and talk more about
Sure.
treatment as we go along. Appreciate you taking the time today.
Sure.
David Zulak.